All right, welcome. Today, we're going to talk about something that's shaping our lives, our health, every single day. But you probably don't even see it happening. Okay, so think about this for a second. Seatbelt laws, smoke-free bars, clean air. We kind of just expect them now, right? You walk into a restaurant, you don't worry about secondhand smoke. You turn on the tap, you assume the water is safe. But here's the thing, none of that happened by accident. It's not magic. No, these protections were built. They were fought for, piece by piece, sometimes over decades. And the force behind it all, that's what we're calling the unseen engine of public health. We're talking about advocacy. So let's get into it. What is this engine? I mean, we hear the word advocacy all the time. But what does it actually mean when we're talking about public health? It's a really specific, powerful concept. Okay, so here's the textbook definition. But let's break it down. It's not just about holding up a sign or tweeting. It's a strategic process. That's the key. You're mobilizing everything, information, resources, people, to build up the pressure needed for systemic change. It's about changing the rules of the game. I love this comparison because it makes it so clear. Think of it like this. Regular healthcare is often downstream. You fall in the river, it pulls you out and patches you up. But advocacy, it goes upstream to figure out why people are falling in the river and then builds a fence. It's proactive versus reactive. It's about prevention, not just treatment. So what's its job really? Well, it plays a few different roles. First, it's a translator. It takes all that dense scientific data and turns it into something policymakers can actually use. Second, it's a fighter. It has to go up against some really powerful commercial and political interests that, well, let's just say they don't always have our health in mind. And maybe most importantly, it's an amplifier, giving a voice to communities that are often ignored. Okay, that all sounds good in theory, right? But how does it work in practice? Let's pop the hood on this engine and see what's actually making it run. Because this is not just about passion, it's about a very specific set of tools and strategies. And here it is, the playbook. Think of it like a five-pronged attack. You can't just do one of these things. It all starts with hard evidence, with data. Then you take that to the decision makers. At the same time, you're building a movement on the ground, getting the public fired up. You use the media to control the story. And, this is huge, you build alliances. It's a full-court press. And this really gets to the core of it. Anyone can complain, right? But advocacy isn't about just pointing out problems. It's about showing up with the answer. It's about having the solution, the new policy, the better law, already drafted and ready to go. It's constructive. All right, so we know what advocacy is and how it works. But now for the big question. So what? Why does this actually matter? Well, let's look at some real-world examples where this unseen engine completely changed the game. Okay, let's start with a big one. Big tobacco. It's hard to imagine now, but for decades, these companies were untouchable. They had enormous power, huge advertising budgets, and politicians in their pockets. It took one of the biggest, most coordinated advocacy fights in history to change that. And just look at the results. This is the before and after. Before you had smoking indoors, everywhere, ads targeting everyone, including kids. Cigarettes were cheap. After this massive advocacy effort, we got smoke-free laws, ad bans, higher taxes, even a global treaty. Every single one of those wins was a battle. It didn't just happen. And here's another incredibly powerful case study where the stakes were literally life and death. During the early days of the HIV/AIDS crisis, the official response was shameful. It was slow, it was quiet, and it was bogged down by horrible stigma and a total lack of political will. But then came the activists. Groups like ACT UP were not polite. They didn't ask nicely. They demanded action. They used incredibly smart, confrontational tactics. They forced the world to pay attention. And because of them, we saw drug prices plummet, research funding skyrocket, and the stigma began to break down. They literally changed the world for millions of people and showed what happens when patients themselves lead the fight. You know, when you look at both of these fights, tobacco, HIV/AIDS, you see a common thread. And it's that this isn't just about viruses or cigarettes. At its heart, public health advocacy is about fairness. It's about health equity. Because let's be honest, health isn't a level playing field. Some communities face way higher risks and have way less access to care. So a huge part of advocacy is intentionally lifting up the voices of those who are usually ignored. Women, migrants, indigenous communities, people living in poverty. It's about making sure their health needs are front and center.
Yeah, this quote says it all, doesn't it? It's grounded in social justice. It's about removing the barriers, the systemic things that stop people from having a fair shot at a healthy life. It's as simple and as complicated as that.
Okay, so this engine has a pretty incredible track record. But the job is nowhere near done. In fact, you could argue the challenges we're facing now are even bigger and more complex than ever before. And this chart really lays out the roadblocks. Look at those numbers. Corporate influence and political resistance are still huge, absolutely massive hurdles. But look at that third one, misinformation. That's a whole new kind of battleground that's making everything even harder.
And we're not talking about some shadowy, abstract forces here. We're talking about very specific, powerful industries. Think fossil fuels, ultra-processed foods, alcohol. Just like the tobacco industry before them, they often have a vested interest in fighting against public health measures.
And when you look at the threats on the horizon, wow, they're enormous. Climate change isn't just an environmental issue, it is a massive public health crisis. We know another pandemic is coming, and all of this is happening in an age of misinformation that just poisons the well. You can't tackle any of this without sharp, relentless advocacy. So here's the bottom line. Without this advocacy engine humming in the background, all the best science in the world just gathers dust on a shelf. Policies get made without considering people's health, and communities, real people, get left behind, unprotected. The stakes are incredibly high.
And that brings us right here to this final question. The big wins of the past came from advocates. They were scientists, activists, regular people who just refused to accept the status quo. So as we stare down these new, massive threats, it really makes you think, doesn't it? Who's going to be the engine for our future?